Okay, kia ora whānau. So the next section that I've been tasked with having a kōrero with you about is section 2, which is the diagnostic guidelines. So we're going to do a deep dive into the values, the practices, and the goals of this section. So we're going to look at overview, referral, holistic assessment. We're going to look at different Māori models of practice. We're going to look at other perspectives, consideration for communities experiencing barriers, assessment principles, diagnostic criteria, additional information, and also feedback and post-diagnostic support. So I'll present some of this, and then my lovely colleagues will jump in and present some of the other parts to this. Okay, so we'll just kick into it. All right, so if we think about the overview, 2.1, what does that say? It says, it focuses on relationships and connections being at the center of practice. So that's a really important value that we've held all the way through here. And it looks at shared decision-making. That's another big value for us. So gathering and feeding back information to create a shared understanding so that professionals and whānau alike have a shared understanding of where to from here. And what does that mean in terms of support? Ka pai, but also respecting the autonomy of individuals and whānau around decision-making about diagnosis and around decision-making about where to from here, who would they like to engage with, and how would they like support. So these two approaches, relationships, connections, shared decision-making, that's what leads to the positive outcomes and better clinical decisions. Okay, so also under 2.1 is a slide that talks about multidisciplinary approach being best practice. So we understand that there needs to be a pediatrician or a psychiatrist who's there to look at the impact of other medical conditions, to look at neurological soft signs, facial features, etc. And then they may be with psychologists, speech language therapists, occupational therapists, or physiotherapists who can assess the other domains. And it's understanding that a multidisciplinary approach is always best practice. So your team may have professionals from various backgrounds. You may have a pediatrician or a psychiatrist who will look at other medical conditions, neurological soft signs, facial features. You'll have maybe psychologists or speech language therapists or occupational therapists or physiotherapists, which are assessing the domains. You may also have social workers involved, whānau support workers, cultural advisors, etc. So your team may be quite big, or actually it might be quite small depending on the area you work in and your access to these other professionals. So I guess it's being mindful that if you are only the lonely and doing it by yourself, that you're really mindful when you're interpreting domains that are typically assessed by others. Ka pai? So a multidisciplinary approach is best. But what are we trying to get to? A shared understanding of the individual and whānau strengths and challenges. And we're looking at one document that's written for professionals and whānau that reflects life events, feedback from key people, and the current assessment information. So in this slide here, 2.2, we're looking at the referral process. So how do we support whānau to have a shared understanding about the purpose of the assessment? So what does that diagnosis mean? Who referred them and why? But also what they need in order for the assessment process to be smooth. So who will need to be in the room? Is there someone that needs to support the person that is undergoing the FASD assessment? Time, settings, place, all of these things, and having the best interests of whānau and the young person at the heart of what we do. So flexing where we need to flex to make it successful. Informed consent or assent. So it's looking at who is going to provide consent for this to occur. And can we give information to the young person or to the person undergoing the assessment so that they understand and can be involved in decision-making based on their level of functioning. Okay, ka pai. So that's all about the referral. 2.3. So this is where my colleague Tanya will talk further, but it's all about holistic assessment. And I'll leave that section for her. What I will say though is the following whakatauki definitely provides an appropriate guide to a holistic assessment. So this is one of my favorites. Mā te kōrero ka mōhio, mā te mōhio ka marama, mā te marama ka mātou, mā te mātou ka ora. So through discussion comes awareness, through awareness comes understanding, through understanding comes knowing, and through knowing, yeah, we get to well-being.